We'll start in a couple of minutes. We're just waiting for everybody to log on and to arrive with us. Morning, everyone. I'm going to make a start. Welcome. I think people are still arriving, and they can catch up as they arrive in. So it's good to see so many of you here. I'm Tracy Hopkins. I chair the VCFSE Alliance and represent the VCFSE on the ICB board. I just wanted to say welcome and thank you very much for coming. It's really good that we can get together like this. It's not quite as good as when we can do it actually face to face, but it's a good substitute to be able to do it in this way. So thank you very much for coming this morning. As with so many of these events, an awful lot of work goes into pulling these together. So before I say anything else, I just want to say thank you to Joe and Stephanie from Community Futures, because they are the ones who are going to make it all work and run smoothly today. So thank you, Joe. Thank you, Stephanie, for pulling all of this together today. So we've got a packed agenda this morning between now and 12 o'clock.
It's too early, isn't it?
And this is the 6th Assembly meeting bringing us together. The last meeting was in person, and I know some of you were able to attend that. So what we want to do once I finish this introduction is just revisit some of the outcomes and some of the actions from the Assembly 5, just so there's some continuity and it feels like we're picking up on things that we talked about at the previous meeting, so we don't lose some of those things that you suggested or that we said we would do. After that, Joe is going to do a poll, which is really about us looking at the state of the sector, a really important piece of work around kind of taking stock where things are, but I'll let Joe tell you more about that. And then what we've got is 2 presentations around really important strategic developments and delivery across the health and care system. So first of all, around the development of a digital strategy, and then we're going to be looking at continuing healthcare, the provision of community support and care that really puts people kind of in the driving seat of planning their own health and care. So again, another really interesting thing to hear about. And then we're going to just briefly talk to you about the next Assembly 7 in March, which will be another in-person event. So that's it from me. In terms of sort of the logistics, please keep yourself on mute. It really helps to just keep that background noise at a minimum. If you have got any questions, there may be an opportunity to ask if you've got any pressing questions at the end of presentations. But what we're going to do is, if you want to put questions in the chat, we will monitor it, and if there's anything really poignant that needs to be picked up now, we will. But we'll address those later down the line. So if you've got anything you want to ask, just pop it in the chat. Okay, so I'm going to hand over to Joe, who's going to kick us off with the updates from the last Assembly. Thanks.
Thanks, Tracy. Stephanie, if you can start to share the slides, please. That would be great.
Yep.
Mike Wedgeworth, have you got your hand up?
No, I haven't, Joe.
No. Okay. All right. That's great. Thank you. Okay, just pop that on presentation mode and we'll be ready to go. Stephanie. Okay, let's just jump straight to the next slide. So we're talking about the workshops that happened in Assembly 5, and just to give brief updates, we had 4 workshops at Assembly 5. We had one from Lancashire Digital Skills Partnership, we had one concerning the Health Equity Commission, one around the workforce strategy from the ICB, and then the largest group of the day was on the voluntary sector working together. So just quickly go through these. This was the one Lancashire Digital Skills Partnership was talking about the resources that are on offer through various organisations and infrastructure across Lancashire and South Cumbria. There was some interest in this, and I think what has come out of that is really understanding what the digital strategy for our partner in the ICB will be, and that is the content of Linda Vernon's presentation later on in the agenda. Stephanie, do you want to skip on to the next one, please? Angela, I'm going to be looking for your help here with this section. The workforce strategy with the ICB is in draft form. It has taken a lot of the work that has gone into, I think there was something like 140 sessions, or potentially maybe even more than that, in developing this up. The workforce strategy has come to the Alliance group, so that happened was that only last week? Yeah, last week, where there was some clear feedback to them from the Alliance on the importance of volunteering, the ways that the workforce strategy seems to focus only on highly skilled and medical careers, and actually that needs to be much more inclusive in the way that it's going forward. So that is coming, I believe, to the People Board on the 31st of January, although there is some confusion about that because it's now been relabeled as a development session. However, there's been some good feedback into the strategy from the Alliance. Angela, is there anything that I need to have missed there?
Nope. Not at all. No, I think it is a work in progress, and actually it kind of overlapped with one of the other workshops that took place at the last assembly, where this kind of issue was raised by colleagues from the sector around what we could do collectively within the sector in terms of workforce, but also what our position is really in terms of the partnership across the whole ICB as well. But no, nothing further to update from that.
Okay. Just to be clear, everyone, this is just me skimming over what has happened since, and then we're going to open this up for more discussion. So it's not like it's just me talking, thankfully, because I get bored of my own voice as well. So the next slide, please, Stephanie. I'm going to have to pass over to Tracy and Angela for this one.
Thanks, Joe. Yeah, I'm thinking back to this. I was thinking this morning, it seems like an awful long time ago, doesn't it, with Christmas being in the middle of it as well. But yeah, we had some lively discussions around health equity, and it was really good that we had Andrew Bennett, who leads on population health across the ICB, round the table in these discussions. And we have done some follow-up work from this, where we've had a couple of meetings. Angela, Joe and I have met with colleagues from population health, really to try and keep the momentum going around our involvement as a sector within the kind of health equity agenda. I think the summary here just gives you a bit of an idea of some of the sort of asks to the Alliance that came out of this workshop. So a simple guide to the health and care system, you'd think that would be simple, wouldn't you, really? That we could have some kind of overview of who does what, where they sit, who manages them, and how it all kind of fits together. We're asking for this. It doesn't seem to be something that is readily available. And probably as well to kind of demonstrate our commitment to that transparency, what we're doing as well is making it really clear as to how our representation works across all the different functions that we've got reps on across the system. So Joe's putting together, I said this yesterday in a meeting, he's going to look at me again and say, am I? Joe's putting together an infographic, I'm calling it, which is going to give us that overview of where we have representatives across all of those kind of meetings, boards, functions and forums that exist across the system. So hopefully that will then prompt our colleagues across health and care to give us some indication of how their structures work and how it all fits together. We had a really interesting debate and conversation about putting the F in VCFSE, so the faith element, which people commented on that it's much more than just faith and religion. It's about the spiritual side of things, and we had conversations around how organisations really feel part of our sector in terms of that input. I know across other systems they use the acronym VCSE and don't always include faith. I think we've always felt across Lancashire and South Cumbria it's really important for us because we recognise the importance of those faith-based organisations and the contribution they make to communities, to people within their local areas. We wanted to make sure that as we develop and go forward, and this is part of the work that's been going on to kind of reform the Alliance, to make sure that we are representative of our sector as a whole. And I think, you know, colleagues who work within kind of infrastructure organisations often talk about the importance of including those smaller community-based, often only maybe street or neighbourhood-based organisations that do so much good work in their communities. We definitely want to see, you know, these spaces, our assembly space and the work that we do, very much open to those smaller groups. I think one of the mechanisms for that is the work that Joe does around keeping the Healthier Lancashire and South Cumbria website up to date. I think it's a space where smaller groups can find out what's happening, and certainly across the Fylde Coast, I've been talking to a lot of smaller groups about, you know, find out what's happening from that area, and if there's any questions you have about how you engage with some of this work, then do ask, because I think it's really important that we don't overlook those groups and we actively try and include them. And also we talked about funding. I mean, of course we talked about funding. You know, it seems to be something that comes up in so many conversations, whether it's around looking at how we collaborate to lever in more funding, whether it's looking at how commissioning rounds sometimes don't always work to the benefit of us as a sector. Again, there's a lot of work happening behind the scenes with the Alliance and with other infrastructure organisations to try and ensure that that our colleagues across the system really understand how to work with us around funding and commissioning. So I'll stop there. I don't know if Angela, Joe, you want to add anything to any of that?
Yeah, just one thing around the website and the last point that you just made around procurement of services. On the website right now is the guides, the resources that we currently have about the new provider selection regime. That is a very different procurement environment, and the regulations behind it moving us more towards collaborative and longer term partnerships than quite transactional competitive stuff that we've had in the past. So I encourage you to have a look around that And if you do have any questions, contact me. I'm not saying I'm going to have the answers, but we'll certainly have a way to pose those questions and maybe get some answers into the website as like a Q&A. So yeah, just encourage you to have a look around there. It's I think it's even on our front page of the Alliance section. Thanks. Okay, so you finished that part, Tracy?
I have, thanks, Joe.
Yeah, okay, let's move on to the next one, and this is Angela.
Okay, so this was unexpectedly, or maybe we should have known that this was going to be the most popular group, not because I was leading it, but because I think it was really important that for sector leaders and those that were in attendance on the day, that despite everything that's happening around the ICB world and ICP, the place-based developments, we need to get on with the day jobs and we need to work across the sector better together. So what can we do whilst everything else, whilst all the chairs are shifting around us, what can we do as a sector collectively? And what are the collective issues that we're facing as well? So in terms of what was raised that day, we talked about the poor relations and equity and parity across partnerships. We've raised this in a number of forums. So whilst we've got representation on probably all of the key strategic groups in the ICB and at place, just sitting around a table does not mean that we can change or influence the agenda. So what can we do to kind of be better at that, to have our voices heard and show that we are influencing? Tracy's just alluded, we spend a lot of time, there's a lot of time that we do talking about how great our organizations are and pitching the services that we operate. But and also a probably disproportionate amount of our time having to report on what we are doing. So can we change that in any way? And I think that's influencing how commissioning is set up. So we can give you a bit of an update on that, I think, following a meeting that we had yesterday. We did talk about accessing. So if it's a true partnership across the ICB, some of the corporate functions that they offer, including human resources and training, can the sector access those? And again, we're working on that. So the workforce development stuff that we talked about to begin with, there will be opportunities for the sector to access the training that's offered to our statutory partners. Equitable partners, we've just talked about that. Transparency of funds allocated and commissioning, as I say, there is a new strategy, I think, that's coming in around commissioning into the ICB. So hopefully we will have some influence over that. We talked about getting a directory of services. Some people will raise their eyebrows at that, or some people might groan about it, but it is something that we need to kind of be responsible for ourselves rather than somebody else coming in and doing that job for us. And I think the Alliance affords that opportunity to do that. In terms of capacity, there's just some bullet points there. I'm not going to read through them all, but suffice to say that this was a really passionate group of people that wanted to see change and to enable change. And I think that that's what we're going to do. So we didn't want it to be just a discussion on the day with no follow-up. We actually want to follow up some of these things, and some of the Alliance leads have been doing that in the background. And I think what we can do with this kind of slide is to do an action plan of what we have achieved today and what we intend to achieve over the next 12 months. So this will be something that we'll come back to on a regular basis at each of the Assembly meetings. And if anyone wants to contribute more to this, if you've got things that you think within your organisation or your local area that needs to be highlighted and you think would be shared by others, please, today use this opportunity, but also contact Joe or Steph, Tracy or myself, and we will put this to the Alliance as well so that we can actually make a difference. So I want to say that I really enjoyed that discussion on the day, and I think it's just the start of what we intend to do over the next few months.
Okay, that's the last of the slides and the updates, so we can go back to Tracy to open up a discussion about what people are thinking.
Thanks, Joe. Before I do that, Angela mentioned, I think it was you, Angela, it might have been Joe, the meeting we had yesterday. So I just really wanted to, it's quite significant for these sort of developments to just give you a little bit of a sense of what that was about. Before Christmas, I wrote to David Florey, the chair of the ICB, asking for a meeting with myself and sector representatives and senior colleagues across the ICB, because, and I put this in the letter, that as a sector we are concerned that as the focus of the ICB becomes very much around resources, so I don't think it's not well known that our system, our health and care system, has faced some really significant financial difficulties. And ultimately, I think the media have picked up on the fact that we need to cut 10% right across the system to just break even. So I think against that backdrop, as a sector, we obviously are concerned about the implications around our funding arrangements, but also I think on that kind of more strategic level, we saw, and I've certainly sensed this since I've been involved with the ICB and talking to other colleagues, I've picked up real feeling that what we set out to do right at the very beginning when the ICB was formed in July 2022 was to address health inequalities, was to focus on people and communities, on the right health and care in the right place at the right time. And I think all of us would say that's why we're involved in this. It's certainly why I stepped up and said I will do this role on the ICB, because like many of you, I've worked in this sector a long time, and that's where I'm coming from. This is about changing things for the better for people and communities. And I think because we've got this really difficult financial situation, what has happened is we've gone right back to an emphasis on organisations and resources. And I think that really sets us back as a system if we don't start thinking about how we change things and transform things in a period of, I suppose, financial crisis in many ways. So we asked for this meeting. It happened yesterday over Teams, and it involved Kevin Lavery as the Chief Exec of the ICB, Sam Profit as the Finance Director, myself, Joe, Angela, and Yak Patel, who's Chief Exec of Lancaster CVS and one of the Alliance members. And we went along very much with that open, a very transparent kind of conversation around what is it we can do to go back to the people and communities emphasis if we've lost that, and how do we work in a more integrated way so that we can ensure that some of this transformation that needs to take place will take place. So there was a lot of conversation around what's gone before and why we're in this position. But also, I think one of the really positive things that came out of it was a real willingness on the part of the ICB to listen to us. I think one of the really interesting things, and without giving you kind of too much of the detail in the background, there was a number of proposals last year that went to the ICB that were worked up sector solutions to some of the big problems that we're facing as a system. So hospital flow, we worked up some solutions to how we deal with that. The kind of the prevention agenda, how do we make sure people are staying well in their communities rather than ending up in hospital when actually it's much better for them to be in the communities. So we put a lot of work into this, and we made it really clear, Joe, Angela, Yak and I, to Kevin Lavery and to Sam Profit, that we felt as if those proposals and those pieces of work had really fallen on deaf ears. They didn't seem to go anywhere in the system. They seemed to just stall as soon as we started to propose them. The usual tricks were there of can you go back and can you work this up into a service and can you cost it for us? And we sort of resisted that a little bit, knowing that actually what we need is the say so on some of this work actually being a commitment being made to it. And I think one of the things that was really clear from Kevin was they just were not ready. They weren't in a position, they hadn't organised themselves sufficiently as the ICB to be able to actually take on board some of this work. And I felt that was a real breakthrough, because I think certainly I was very much kind of full steam ahead, and I know other people that I spoke to, because I chaired one of those groups that worked up a proposal around discharge from hospital. And I think it was really frustrating, because you'll know it's really not easy to corral people in our sector to come together, to develop something collaboratively, to not think about their own organisation, but actually work on something for the greater good. So it took a lot of effort on all of our part to do this work. So to have that acknowledgement that actually you were kind of ahead of the game on this, and we just weren't in the right place. So those proposals have definitely not gone away. But what we're going to do now is work with colleagues across the ICB to look at where they fit and how we can start some of this work. And it might be starting it in certain geographical locations, or it might be starting it really small and building it. But I think the emphasis that they placed on it was that we need to be in those places where decisions have not yet been made. And we all said, the four of us, that at the moment we just don't feel we're invited to those tables. So there was definitely a sense of we will be more involved. And one of the quite tangible outcomes was we're going to have quarterly meetings like the meeting yesterday with Kevin Lavery. We're going to make sure that when development plans are in place, so at the moment there's I think somebody put in the chat the recovery and transformation plan. NHS England have asked our ICS system to develop a 3-year plan. Now, a 3-year plan is a bit unheard of across health and care. It's usually an annual plan. But they've been asked to pull together this 3-year plan, very much in its early stages. They were very honest with us and said, actually, we don't know what's going to go in this plan, but there was real recognition that we as a sector need to be developing this plan collaboratively with colleagues across health and care. So I think something really quite positive. I mean, don't get me wrong, there's still a huge amount of work to do, and I don't think all of these well-intentioned things will happen overnight. I think we're going to end up having to be a bit of a thorn in the side of some of the colleagues across the ICB, the senior colleagues, just to make sure that they do the things that they've said they're going to do. But I think a real kind of sense of we're all working for the same ends, and actually this is about ensuring that people and communities get the right care and the right services in the right place when they need them. So I just wanted to kind of it's very new, because it was only yesterday we met, but I just wanted to kind of give you a sense of that direction that we're going in, because it does relate to a lot of the conversations we had in the last assembly, and I think we will carry on having these conversations collectively across these forums, because I think it's really important to capture your thoughts around this. So what I'm going to do now, we have got a bit of time before the next item on the agenda, so I just wanted to open it up and see if anybody's got any questions or any comments about any of that. Okay, I think Terry, you've got your hand up.
Thank you. I'm just and thank you for the update on that meeting yesterday. And so I appreciate what you're saying about them saying, well, we just weren't ready, blah, blah, blah. But they must have been ready to communicate. They could have been ready to say, we're not ready. And instead, it had just appeared to disappear into this abyss. So was there at least an acknowledgement that they had just been ignoring us? So I appreciate them saying, you were ahead of it, we weren't ready. But that just feels like a bit of a fob off, to be honest.
Yeah, absolutely, Terry. And I think they hadn't recognised they weren't ready. I think that was part of the issue, really, that realisation has only recently started to kind of come in as other things have developed, because when I think back to where those proposals originally came from, and I said this yesterday to Kevin Lavery, Kevin, you came to Blackpool, you gave us as a sector a call to action around this, and we did it as a result of your call to action, saying, you have some of the solutions to these problems, we want to work with you. And I think it was difficult for him. I think it was uncomfortable at times, because I think there was a real sort of feeling of, well, we're going to have to acknowledge that we've probably not moved forward as an ICB in the way we expected to when we formed. I think when a new organisation comes together, there is a sense of, we're going to change things, we're going to move forward, we're going to fund prevention, we're going to look at, transforming services. And I think we're not the only people who are sort of saying, well, actually, all those things that you told us, we've had to kind of delay and wait. I think in terms of acknowledging that they ignored us, I don't know that they did really ignore us. I think it kind of bounced around in the system, not knowing where to sit. And that's where I think the urgent emergency recovery and transformation group is now the place for this work. And I think that's where, they've acknowledged that's how it's going to go forward. But I absolutely take your point. Yeah. Sometimes we just need a bit of an acknowledgement, don't we? And say, well, we're really sorry. We didn't quite get it right. Which I think they've done.
Thank you.
I've not kept track of anybody's hands. I think Mike was next.
Thanks, Tracy. Can you hear me okay?
Mm-hmm.
I'm getting feedback. I think all you've said is absolutely right. And I think the time is coming when we need to be, I won't say aggressive, but more assertive. And I think what you've described is an example of that. They just don't, the senior top level people are so preoccupied with this massive deficit and realizing that the hospitals are the ones who are going to reduce it, which they can't, that they think that things like commissioning and all that has got to be put on the back burner. I've written to several people at various levels in the organisation, Craig Harris, Andrew Knox, and Andrew Bennett, and they're all sympathetic and supportive even, but it just doesn't seem to get through the board. And I think we need to do something fairly strong about this, along the lines of what you've described, but also probably coming up with some concrete proposals about what can be done by the sector, and ask them to respond to that, rather than having a general discussion about, it'd be nice if you'd give us more commissions. I think that would be a way of demonstrating that this mantra about care closer to home, in which we have a massive role, actually means something.
Thanks, Mike. Howard's next, I think. Hi, Howard.
Good morning.
Morning.
Morning. I think you've done really, really well. I think this is good to have that dialogue. I think the tone, the way you put it, Tracy, is absolutely spot on. So I think really well handled to you and the sort of team. The situation in the ICB, having worked in it and moved out and sort of moved back into this sort of sector, is a lot worse than I think most people think. If it's not inappropriate, they are absolutely screwed. It's really, really tough for them, and cutting out already limited resources and the number of people that were doing various things just sort of adds to their issues. And then there's this disconnect between central thinking and strategic thinking, and then what's going into hospital work plans and hospitals' way of working, which is, as we know, where most of the spend goes. And so while they're listening, and everything that Mike said is right, those people are sympathetic, how it translates into the hospitals just doesn't seem to be occurring, because I've had sort of similar conversations. I think what we've got to remember is we're on the same side. The folk in the ICB are not the enemy. They're not at all. They're doing their absolute best, and we've got to keep on with that message of going on what we can do and pushing the new thinking. And it might not land, but that doesn't mean we've got to stop. I think we've got to keep going. If there is an enemy, it's down to that inequity. We're coming from behind as a region. We've got amongst the worst health equity in the country. We get crap funding. Our settlements don't represent that equity, and we're just going further down. So if there is a battle to be fought, it's between the government, the Treasury, the NHS centrally, but not our local folk. Done. Rant over.
Thanks, Howard. Yeah, absolutely. Totally agree with you on all of that. And I think that it was definitely a kind of a theme of yesterday's meeting, that we want to feel as though we're working to the same ends here. And we certainly left the meeting with that sense of we're all on the same side here. So yeah, thank you for that. Raki, is it?
It is, yes. Hi, everybody. Yeah, thank you for inviting me, and I hope it's okay to chip in here. Is it okay, Tracy, Joe?
Yeah, of course, absolutely.
Brilliant. Oh, I have to say, what a sensational effort, Tracy, with Kevin and Sam. So, really, really well done for getting that forum with the two of them to be able to listen to you, and also to get that, that a really open and transparent feedback from them, which is great. And I have to say that I'm Raki, everybody. I'm Associate Director of All Age Continuing Care, and I've been for the ICB, and I've been part of the ICB for the past year, and in that time I've seen it emerging. So it has had to get itself together. It has had to they started to develop sort of place-based leads, and everyone was trying to find their feet. They were trying to find the forums by which approval requests would come in for, some of the requests and some of the offers that you'd put through to the ICB. Some of that was developed, took a long time to develop, and it's still developing as an ICB. So I would say, and as Howard's pointed out as well, it is in a very, very difficult financial position. However, that aside, it is still developing as an ICB, and I would say that it's really great that you've got that forum into the ICB, like you've said. You've got that quarterly meeting with Kevin and Sam, and I do agree with what some of the others have said in the room today in response to your meeting, that I think you do have to keep banging on the drum, and really do keep letting them know what you have to offer. And just to give you a bit of support, Tracy, as well, in that with your business cases or proposals that you put through to the ICB, I think at the moment they go through a group called CRG, and everybody has to make sure that they're worked up financially. Nothing gets through that board, believe me, without a really fully worked up proposal. So it's not something that, it's not a process that's singling you out as a sector. It really is something that everybody has to ensure they do robustly and in a way that's I guess not meaningful, and in a way that can be digested by the group that read the proposals. So we can come to this a bit later. This is where I can help you a little bit if you need in my role. But sterling effort, I'd say. Yeah, really well done.
Thanks, Raki. It's really good to hear that from kind of like that inside view, I suppose, of within the ICB, and obviously you're relatively new to it as well. So yeah, it's good to hear that. Thank you. Joe, I don't know if there's anybody else with a hand up, but Joe's next.
Thanks. Just from the three earlier people, just a point about Terry's initial point about recognition of the timing. That was addressed to the partnership agreement as well. So I think there was a clear admission essentially that we did a heck of a lot of work with that partnership agreement. It's a really good document. But kind of like Terry, you even asked me at one point, so what's happening because of it? And I think there was a recognition in the meeting yesterday that they feel the same way. And actually, where I'm more clear now is that the intention is how do we collectively put the meat on the bones for that during this next year. So I'm more confident now, having spoken to them yesterday, that there is actually that commitment forward, that there isn't going to be a cliff edge, and that actually the real work of it is how do we put meaning to those words. Just on the points that Howard and Mike were making, I think, Mike, that turn is implicit in that you mentioned about the strength of the message and the assertiveness of the message is implicit in what the letter that Tracy sent and the regard that they paid to it, because I think it was surprisingly fast that they came back with a meeting request. On Howard's point, it's definitely persistent and consistent messaging that we're bringing through, and all of this is through the gestalt of the conversations that we have in these assembly meetings, in these alliance meetings that we have more regularly. So I think the persistence of that and the consistency of that is really robust. And as I said, with that sort of inkling of more of a commitment going forward, I think that consistency is more assured, because it is a capacity issue, isn't it? People being able to get together and think about this and come to some kind of agreed tenets on how we have the discussion is a capacity issue in itself. Just finally, Howard made the point about health inequality. It's absolutely crucial, a key part of the messaging. What you were talking about, though, was like a bigger talking shop, wasn't it? Like a national stage. And one of the things that I think we as an ICS are missing is the power of a really strong partnership that can give power to the elbow of people who are having these discussions. And actually, Kishwa's already mentioned some of it, but some of this can be articulated in a way that can really help those discussions on the national stage. So that was another point made yesterday, was that as a partnership together, working on those things that we all agree on, we could be immeasurably stronger than we are now, but we're not taking sufficient advantage of that. Thanks.
Thanks, Joe. I'm going to bring Angela in for probably what will be the last word, but before I do that, I just want to pick up on a couple of things in the chat and just really say something sort of from my perspective. And I want to just thank people for the support, first of all, because I think, you know, it is quite difficult to have these conversations. So thank you for providing that really obvious support there. I think the other thing, you know, Joe's just said it, we've painted a really very positive picture of this, but don't get me wrong, I all of the time, especially when I go back into my day job as Chief Executive Citizens Advice in Blackpool, I'm incredibly frustrated by the fact that we haven't invested enough in preventative work. And I also get very frustrated when I listen to a lot of the discussion around the financial position that we're in, because like many of you, I sit there thinking, well, if you'd have listened to us 5, 8, 10, 15 years ago, we wouldn't be here, because actually we were saying then we need to transform and shift the emphasis away from treating people who are sick to preventing them from becoming sick in the first place. And I always say that my organisation, Citizens Advice, does exactly that. We work with people to prevent them from becoming sick by maximising their income, putting them in situations, the better housing, all of those things that we know are absolutely fundamental. And I'm sure you're sitting there thinking, yes, my organisation does all that too. And it's really frustrating, isn't it? Because we go into these situations thinking we have these solutions, we know what to do. I know it's not simple, and I know I'm making it sound much more simple than it is. But don't get me wrong, when we kind of come to these discussions, there is an element of cynicism there with me thinking we really do need to change things now. We've been saying we're going to change things for an awful long time. I think if we don't do it now, I don't know about you, but I'm probably not going to be around for the next 5 years, because I think we've all become a little bit fatigued by trying to change things so much and only finding that actually the same old things happen. So whilst everything I've said before, this has been really positive, I just wanted to share that with you, because I'm sure many of you, and I can see that in the chat, feel that the prevention agenda has been around a long time. Let's actually do something about it this time round. Go on, Angela.
I think Joe might have actually just referred to the point I was going to make. One of the things that we talked about yesterday was following on from the task and finish groups, where we came up with plans that the sector could support the pressures on the system. The ask was, well, what does that mean financially? You know, what the costs of the VCFSE response, how much is that going to save the system? Now, and I know some of you do have formulas for that, and actually we could probably do that in terms of measuring impact financially, but is that down to us to have to do it? You know, the people with the answers to that are actually the people that are running the system. So, you know, those in the hospital settings at LSCFT, you know, all the providers. So what we said to Kevin and colleagues yesterday was, can we do this collaboratively? We'll give you the response on our ways of working that are going to, you know, support the system and ease the pressures. But can you tell us how much these are going to save? Because we don't know how much in real terms, how much these issues are costing you. And actually there was an agreement that, yeah, of course we will do that. We'll do that as a collaborative rather than you coming to us, you know, providing solutions, but also having to do the legwork in terms of finance. And I just thought that was, you know, they really do put us through the hoops, or they have required us to go through the hoops before up to this point. Actually, we should be, as Howard said, working together in partnership to provide the solutions that will save the system money. So it was definitely put there, and hopefully we'll work collaboratively in that in the future as well.
I think that's a really good point, Angela. Yeah, thank you for raising that and reminding us that we have that buy-in to co-produce those solutions. Thanks. Okay, so I'm going to move us on to item 3 on the agenda and hand over to Joe.
Thanks very much. Stephanie, if you could put the slides back up on the relevant slide. We will have, excitingly, we're going to have a poll in this section, so Stephanie will control that in the chat or whatever it's called. I don't know if it works through the chat. Can you tell I really know what I'm talking about? Thank goodness for Stephanie. So yeah, this has come out of a number of things. Stephanie, if you can go to the next slide straight away, please. Thank you. Essentially, what we're proposing here is something that you'll all have heard of before, which is a state of the voluntary sector report. Why? A lot of it has come from the conversations that we've had over the past year or so, and particularly the voluntary sector working together workshop at Assembly 5, where it's quite clearly stated that the sector is poorly understood in many ways by in our partners, and in some ways by ourselves as well. The Charity Commission gives some information, as many of you will know, the NCBO Almanac derives from it, but it is very much, it's about registered charities by definition, so it's not about social enterprises. It doesn't talk about community groups. The charitable functions of faith groups are obviously included in that, but what it doesn't talk about is our people. It doesn't talk about our challenges. It doesn't talk about our activities. And having done some work on this, which I'll touch on in the next slide, it's very difficult to actually configure to make it look like it reflects Lancashire and South Cumbria. Why that's important is it is difficult to understand how to integrate with, and particularly how to work in partnership with, something you don't really understand. And having come from the private sector before moving into the voluntary sector, I empathise with that, because I came into the voluntary sector being kind of aware of Age UK and Bernardo's and what have you, but that was pretty much it. It took a while for me to start to realise the breadth and sheer scale of the voluntary sector in Preston, never mind the voluntary sector in Lancashire and now Lancashire and South Cumbria. So I suppose the proposal is to start to do something authoritative about this together, that we can work on as the voluntary sector assembly, and not just certainly starting with us and people who turn up to these meetings, but also all of the people that we know who either don't or haven't been involved previously. Other ICSs and other voluntary sector alliances, because there are 40 voluntary sector alliances across England, it's not just in Lancashire and South Cumbria. Yes, Anton, definitely. The acronym is VCSE nationally, although VCFSE is definitely starting to permeate more. So it's happened in Cheshire and Merseyside, and Manchester are starting to talk about it, and nationally NHS England is, I wouldn't say they definitely do it, but they're aware of it. Some of those that I'd just like to highlight, Alexandra, I'll come to you in a minute, is the Cheshire and Merseyside one, and the Humber and Yorkshire one. Those have definitely had quite an impact in the way that the system relates to its voluntary sector partners, giving them a very clear sense of the scale and scope of it, but more importantly, the impact. And something that Kishwar mentioned before was the added value, like the additional resources that are brought into the system through the voluntary sector are quite well set out in these. And it has led to a number of things, including fair funding protocols. So there have been changes to the commissioning and other frameworks. There has been invest to save policies adopted where they hadn't been before, system-wide volunteering approaches and what have you. The list goes on. It's all about, circling back to Howard and Mike's points, about that consistency. Is that, you know, our experience with the partnership agreement is it's not good enough to just do a document. There needs to be consistent effort behind it. Did I see Alexandra Guy had a hand up? Do you want to jump in on this at any point? No? Okay, no problem. In that case,
I can't see a hand, Joe.
I could have swore I saw one, but it doesn't matter. So those are some of the whys, not all of the whys, just the ones that I could fit on the slide. So if we move on to the next slide, Stephanie. What we've been slowly doing is talking to people around why this is important and how might we achieve it. So we have done, there has in the past been stated third sector trend surveys by Durham University around Lancashire and what have you, but it hasn't had the impact that we had thought it would have. So what we've been doing is try to tie it into the strategy work of the ICB. So the first part is the Research and Innovation Collaborative. So this is led by Sarah O'Brien, who's the chief nurse. Research is a key role, like an actual function that is required of an ICB. So that collaborative is willing to consider making understanding the voluntary sector part of its strategic priorities. And that gives us a hook. It's not us doing it for ourselves and then launching it at partners. It's actually, we can start to develop this together, and that we can marshal resources around it through that collaborative. Part of that collaborative is the COREN. Some of you may have heard of that, the Community Research and Engagement Network, which is part of the Applied Research Collaboration for the North West Coast, which is part of the National Institute for Health Research. So there's a bunch of resource available there in the research space, which goes beyond what I call research, which is basically Googling. So that's the first avenue. The second avenue is that NHS England has developed a quality development tool. Some of you may remember that in September 2021, NHS England issued guidance for ICSs on working with the voluntary sector. And one of the questions in there was, have you mapped your voluntary sector stakeholders, understanding their capability and capacity and what they bring into the system? And the answer at that, for us is still no. What NHS England have done is they've iterated the questions, the quite simple questions in that guidance, into a pilot of a quality development tool. Quality development tools people will know, presume, quite well, and there's a good provenance of those in the voluntary, in the NHS, giving levels of maturity, and there are reasons why that level of maturity is picked, and examples that support that assertion. Lancashire and South Cumbria has been part of the piloting process for this quality development tool. The Alliance has been involved, as has the ICB, and we have already done a bunch of work about what this looks like. There's a next stage coming to that where we'll be coming to you about it, and I think we're going to be wrapping it up in if this proposal works, in the state of the sector stuff. But essentially, it's the first priority that we've noted is that understanding the value of the voluntary sector, and a state of the sector report is one of the suggested actions under the quality development tool. Next slide, please, Stephanie. So what we're proposing is to begin, this is the beginning to scope a state of the sector research project, one which has key strategic links into the ICS and its partners. Who would be interested in conducting the research and who of us would be happy to be involved? Gaining the necessary resources and appointing a steering group, and then actually conducting the resource through the assembly and asking you all to help us to spread it as widely as possible. Use the findings to inform our interactions with all of our partners and to help, I've not finished that sentence, to help improve the health outcomes for our populations. And then the ambition would be that this would become a periodic piece of work that would then be used to identify trends. So that's what the proposal is at the moment. What we've got next is a little poll that Stephanie's going to run. While that's happening, I'm happy for anyone to chime in with any thoughts about state of the sector reports and what have you. But that's me for now. The poll should be coming up. This is part of us presenting it to the ICB's Research and Innovation Collaborative. Really just getting the idea, are you interested? So there's 3 questions, yes or no. And just click through them. The third question, if there is anything you think we need to do or haven't thought of, is still a yes or no question, because we couldn't figure this in a way that would allow you to comment on it. But you can either pop that in the chat or send it to me on email. I presume everybody has my email. So I'll just let that run for a while. In the meantime, though, if anybody has any points they'd like to raise now, I'd really welcome that. Thank you. Ishwa.
Hi, Joe. Sorry, I might have sort of like blinked and missed the important bit of the information. Is this a research project for the sector to sort of work on, or is it for the other party to work on? I'm missing this.
So approaching it as a partnership, in partnership spirit. So this is the why that we were saying before, was because it's hard to partner with something you don't really understand. So this is the start of trying to articulate that in a robust way. It would be done as in the involvement in answering the questions would be through yourselves and others on this call, and hopefully others that you know that aren't part of the assembly and what have you. Get it as wide as possible. And the idea is that starts to lay some clear foundations for how we work forward. Does that answer your question, Kishore?
It does a bit. I'm just trying to figure out if we're sort of answering questions about ourselves and how we function, whether people that really need to know, they should be coming and asking us those questions so they get a better understanding. Sort of who leads the research, if you know what I mean. If I wanted to go and find out about an agency, I would go and do it. I wouldn't expect the agency to say this. I mean, you know what agencies do. Here's my piece of work. But if I want to get to the nuts and bolts of it, I'd go and do that research within that sector myself. I'd get a better understanding as a result. I'm just trying to put it into my head as to what's going on.
I think that's probably a bit beyond where we're thinking at this point. This is really talking about the overarching figures, understanding, like, for example, what's that awful acronym, gross value added of the voluntary sector in Lancashire and South Cumbria? What's the scale of the income and expenditure? What's the additional value that's brought in by the activity? So I think you mentioned in the chat how many people, how many voluntary sector organisations bring resources into the area that's nothing to do with the members of the Health and Care Partnership. That sort of stuff being articulated and people going, I can get it now. Talking about the size of the workforce across the whole of the voluntary sector, what proportion of that is voluntary, what proportion is paid, what are our challenges? You know, the recruitment thing that was mentioned earlier in the from the workshop outcomes. What are we doing about those together? These things we can all bring into it. But then your other question was who's leading it. I said in the third slide there that we'd need to get a steering group together around it, and that would be something that I'd really want other people to be involved in. So I hope that answers that question.
Yeah, no, thank you for that. Sorry, I'm a little bit off task today myself. No problem. Thank you.
Thanks, Terry.
Thanks, Joe, and appreciate this work. Just an apologies if I missed it. Was there a timescale that we had in mind?
There is, by virtue of resources, it would need to be within the next calendar year. Yeah.
Okay, thank you.
Kishwar, has your hand gone back up, or is that a legacy hand? Legacy hand. Okay, so that's pretty much 100% agreement that this is a good idea. 80% of people want to get involved, and just under 90% say that there's nothing we haven't thought of. So I'll expect 14% of you to send me emails with your thoughts. Okay, that went really well. Thank you very much.
Just before you get off the hook, Joe, there are a few questions in the chat.
Okay.
Jeanette's asked, do you think the sector's spending a lot of time on doing this work will impact anything at the moment? Putting you on the spot there, Joe, with that one. Hey?
I do, Jeanette. I think you know me well enough that I'm not going to waste my time. I've seen the impact this has through the Voluntary Sector Alliance peer support network across England, and it is, I don't know what the word is, but it is evident that areas that have done this appear to have a more mature relationship between the sectors. I'm not saying that causation, correlation, but it seems to be a feature of all of those. So really understanding and getting into the weeds of what it is. Now, there is a chap who has done a number of these, a professor at Durham University, and he has a particular way of doing it. Entirely valid. I'm not sure it would help us in our situation, so that's why I'd want to develop this with us all involved. Will it change something this week, this month, this quarter? No, but I think over the longer sort of medium to longer term, yes, I think it can set the stage for that, very much so.
Thanks, Joe. Just to echo that, I've certainly seen across Greater Manchester this piece of work made a massive difference. Just being able to quantify the investments in the sector and being able to demonstrate how much of that is coming in externally to the patch was just incredible, and made a lot of people who were already funding the sector in Greater Manchester area really sit up and pay attention and think, if we didn't fund it, maybe the ability to lever in other funding would be lost as well. So even just that small outcome is really important. I think Donna put her hand up first and then Terry.
Thanks, Tracy. Just going back to like this social return on investment and financial return on investment. Joe, I remember part of the central board about 5 years ago we did this and presented it at that time to the, you know, CCGs. It was originally coming out of it, Sarah James and all the others, you know, to show what contribution socially and financially we had and quite how big we were. And we, even though there wasn't very many of us that had contributed the data, we were still bigger than district council. I'm just thinking, we did all that then, didn't make a blind bit of difference. We're still here now, 5 years later. The sector is always being accused of being quite fragmented and various things and can't pull itself together. But I think this shows absolutely the opposite. The same way we can react to a crisis faster than any other sector. It's the same way we can all come together faster than any other sector. We were ready. We've been ready a long time. They're not ready. I think a lot of this, we just keep putting more and more on us, and it's the other sectors deflecting their incapacity and incapabilities back onto us for us to just keep proving another thing, another thing, another thing. Yeah, they have it in theory, but you know, and all the social return on investment or social not return on investment, they have it all, but it's like a doctor going to university doing, you know, a lot of writing and reading and learning about being a doctor, and then saying, yeah, of course you can operate on my son on his heart bypass. Not a freaking chance. Everybody can do it and put it on paper, but it's actually doing the stuff. And I do think we're constantly bowing. And we've been doing it a long time. And we're always having to show what we've got, what we've done, how much we can do it, how fast we can respond. And I think the fact that we actually do respond that fast and do put everything on the table is proof enough. And yet still they're nowhere near ready. And we could carry on this another 5 years, and then what will be the social return of their investment in us? Will it pay for all the time and effort and energy we've put in, or will it just be another loss that the VCFSE sector are going to sustain?
I mean, that's definitely, so taking your last point first, I can't think like that, and I think the new paradigm of the relationship we've seemed to be getting suggests that it won't be a waste of effort. And just on your earlier point around the work that was done in central Lancashire, that was two things. First one, it was part of the recognition that led to the NHS England guidance, was about the commitment. I mean, it was something like 700 hours that was dedicated to that across all of the people that were involved. But also it was part of the case making along with all of this around trying to understand the sector. There's already been an awful lot of work done, and we've already got a lot of these things. You know, some of the stuff around the workforce was directly out of that work. So I don't think it's an entirely lost cause, and as I said, I wouldn't do it if I thought it was. There's always the chance that it doesn't work. I'd be lying to you if I said it was definitely going to work.
I think
Who
the
else
final
is there?
word goes to Terry before we move on.
It
There's
was just
Dusty as
it
well.
was just a really quick point just to support what had been said about this work not being a waste of time. I think the more that we can do that evidences the added value and more bang for buck. If you buy this, you get all of this. And I know just from a conversation I had earlier on this week with some commissioners within the ICB, and it was really useful to be able to say, you pay us to do this, but we also bring in all of this extra money. And actually, if you don't pay us to do this, then we've got less resources to go and get all of that other money, which supports the work that you're paying us to do. And we know from the conversation with the commissioner that that mattered. Now, you know, I've got a team of people that can pull that information together for me, but particularly for some of the smaller organisations who don't have that resource to pull that information together for themselves, I think this work is absolutely vital to show the added bang for buck that commissioners get by working with our sector.
Thanks, Terry. We've also got Dusty.
Yeah, I just wanted to make a comment that I'm part of the Lancaster District Health and Wellbeing Board, which used to administer the PIF funding, you know, the Public Health Investment Fund. And the ICB so far haven't decided whether we're going to get any allocation this year. And this goes to a lot of VCFSE organisations. But the figures I've heard on the rumour mill are basically a fifth of what we used to get. So we're not going to be able to fund as many VCFSE organisations as we've done in the past. That's if we do get any decision from them and we're allowed to administer it again.
Thanks, Dusty. I don't know if you're talking to Yak Patel in your area at all. I think
yeah, no,
Yak,
Yak and I are really good mates, so yeah.
Good. Yeah, you definitely get the support there with that from Yak. Okay, I'm conscious that we've gone slightly over, and I've seen that Linda Vernon has joined us. So I'm going to hand over to Linda for the digital strategy presentation.
Thank you, Tracy. Jo, am I sharing my own slides or are you? Oh, or is Stephanie? Oh,
Stephanie should be so. Yeah, there you go.
Excellent, super. Thank you for inviting me to come and join you. I'm on a tethered device at the moment, so hopefully my signal will stay okay. And great to see some familiar faces that I haven't seen in quite a while, and great to see some new faces as well. So my official job title is Head of Digital Empowerment at the ICB. I suppose the role itself is titled because I do a lot of work around citizen and population level sort of digital engagement and some of the tools that we use to support our patients and public. But I am currently also finalising our digital and data strategy, and here today because Jo asked me to come and sort of give you an update and sort of have a bit of a discussion around what that might mean for you and how we can get sort of more closely aligned and work more closely together. So I'm aiming to talk for no more than about 10 minutes. There are more slides, unless Jo's deleted some of them. There are more slides than I intend to spend time on, but I'm happy for them to be shared afterwards. Just not publicly yet until the final strategy has been ratified, but happy to send them individually to people as long as you promise to keep them as draft at the moment. So thank you. So Stephanie, can you move on for me? Okay, so main reasons I'm here. First of all, to re-engage. As I said, some of you I know quite well of old, and the digital leadership team at the ICB has changed over the last few years, from STP days to ICS, and I've worked closely with some of you in the past. But as the sort of organisational change has been taking effect and is still taking effect with the development of One LSC, we haven't been working as closely together as we perhaps might have liked. And I don't know, Jo, are people familiar with One LSC? Is that a concept that people are aware of
I'm not
around.
even sure I'm aware of that.
Okay,
Linda.
okay. So I'll briefly touch on it, and it does sort of come in the strategy later. One LSC is the corporate services delivery vehicle, single delivery vehicle for the trusts across the ICS footprint. So they are moving things like procurement, IM&T, so information management and technology. It's not quite called digital. And I suppose ultimately things like HR functions, finance functions into a single delivery vehicle. So that means that the ICB digital team that work in partnership with the trusts and the councils and yourselves will sort of change what it looks like, because some of us will end up in that sort of new organisation that's being hosted by East Lancs. And I think there's some information out there on the internet, and it's that the vehicle's being called One LSC. So yeah, I'm back here to try and I suppose stimulate new relationships and reconnect with some of our people we've worked with in the past. I'm going to give you a brief overview of the strategy and how that might impact the sector in good ways, hopefully, and how we might get you more involved and have more benefits received from some of the work that we're doing. And then there's a few specific things that I think it would be good to get people involved in. So Joe and I are working with Stuart Bond, who leads what's now called the Lancs and South Cumbria System Intelligence Service. Some of you may remember it as Nexus Intelligence. It's a population health tool that aggregates lots of data from health and social care and local government, from some of the district councils as well. And we want to try and develop some use cases with the sector so that we can give you access to this really insightful sort of look into some data around our populations and you can drill down to place, neighbourhoods, that kind of thing. So so yeah, the strategy itself. So you've seen sort of the draft highlights of it, really. There's a bit of work still to be done to finalise it, and it is going to the ICB board for ratification on the 13th of March. And there's a piece of work going on around the whole digital portfolio and how the governance can really enable that. And again, that's where I think some of these projects and programmes, particularly around the data stuff and the digital inclusion, it would be really good to have sector representation, because I don't think any of you are on any of those programme boards, and I think that there's real opportunities there. So now the last slide, I think, what are we going to do next? So, and I've already touched on all of this. So Joe and I haven't finalised a date, but we are going to host a half-day workshop to try and really explore what uses you might have that the data that's held within the System Intelligence Service, formerly known as Nexus, might help you guys to sort of problem solve, really, and how that can give us a sort of a legal basis to share that data for supporting our population. And then the bit around the digital programme governance, I think that's probably a few one-to-one conversations to just see who might be best placed to get involved in some of those programmes of work. And then you guys might have other ideas about how you would like to get more involved, how we could support you better, and maybe how we could better understand some of the challenges you have that digital and data might be able to support. And I've probably spoken for longer than I was supposed to. I apologise, but I'm happy to take any questions at this time.
Thanks, Linda. I think because in the interest of time, we're probably not going to take any questions directly. There's been quite a lot going on in the chat. There is the workshop as the follow-up. So I think what you've done today is provided a really good overview of the strategy. I think what we'll do is, as you've said, people can contact you, but also because it's going to the board in March as well, I'll be there around the table at that board meeting. So if people have any questions, any, sort of high level strategic things that we're thinking about as a sector, then I'm happy to take those to that board meeting as well. But I'm not going to be able to open it up to questions, I'm afraid, because we just simply don't have enough time at the moment. But thank you so much for coming along. Really informative, a really key piece of work. And I know behind the scenes, you and Joe are doing a lot to ensure that the data and the information we generate as a sector is absolutely included in this work. So yeah, thank you for that.
I'll try and pick up and do like a written response to some of the questions. And I've just put my email in the chat if anybody wants to reach out directly. Okay.
Lovely. Thanks, Linda.
Thank you for
Good
having
to
me.
see
I'll
you.
pop off.
Thank you.
Cheers.
Bye now.
Bye-bye. Bye-bye.
Bye-bye. So I'm going to move us on to the next item on the agenda, because Raki's been here patiently waiting, listening to all the conversations. So thank you for your patience, and I'll hand straight over to you, Raki. I think the presentation's ready.
Oh, thank you, Tracy, and it's been lovely to be invited from the start, and I've really enjoyed listening to all the conversations and being part of it. Thank you. So yes, like I said earlier, I'm Raki Jethwar. I'm Associate Director of All Age Continuing Care and Individual Patient Activity for the ICB. So I'm going to do this presentation now to you all, and I think hopefully it'll only be around sort of 10 minutes, but more if need be and if permitted. Okay, Stephanie, would you like to change to the next slide, please? Thank you. And again, brilliant. Okay. So the main purpose of this presentation is to really emphasise that the service which I manage, All Age Continuing Care, AACC, we would really like to work collaboratively with yourselves and sector to further develop our service model, and also not just that, but to see what we can do together and what we can achieve together. And we are still very early on our journey as a service, and I'll tell you about that shortly. So, like I said earlier, I've been with the ICB for a year now, and some of the main things I've been involved in is in housing the service from MLCSU. So a massive amount of work was undertaken in the early part of last year to write a business case, get this through board, go through NHS England and panel meetings with them, significant numbers of papers and documents, and we managed to get the service in-housed and TUPE'd over from CSU on the 1st of October. So that was only a few months ago. And we have also created a brand new service model for all age continuing care. I'll go through some of the details of that with you shortly. And just a little bit of a synopsis is that we've got specific, it used to be a single point of access for our clients to access the service, and now we have specific place-based teams for CHC elements of the service. We've got a children's team, and we have developed a new team for discharge to assess for individual patient activity and children's. Okay, next slide, please, Steph. So we have a hub model. Just pause there, Steph, thank you. And so within the hub, we have our leadership team. So we've built and grown a senior leadership team. We have a business support team within that, a commissioning team with a brokerage and contract function, and also a quality team. And I know we've got a couple of members of our quality team in the meeting with you here today, Rebecca and Joe, believe, and I'm not sure if Steph's joined us, but Steph, she might well have done. Okay, click again, please, Steph. So we have 4 place-based teams. Just click it 4 times, Steph, and you should pop up. Okay, so Blackpool plus Fylde and Wyre, Blackburn with Darwin, plus East Lancashire, and South Cumbria and North Lancashire. And the purpose of this is to ensure that our clients can have, and anyone referring into the service has, key points of contact. And there are teams responsible for their caseload of work within those areas, duty, case management, reviews, and there are key points of contact. Okay, next slide, please. All of our place-based teams will carry out the following, which is the duty work, which is any requests coming into the service, changes in packages, any package of care breakdown, etc., safeguarding, any urgent requests, completing CHC community assessments or receiving those, fast track referrals or referrals for funded nursing care. And the team also will carry out reviews, case management, quality assurance of assessments and the ratifications. Next click, please, Steph. Okay, we've got those contact details there below. And next slide, please, Steph. We also have a discharge to assess team, and this team is our hospital facing team. So the purpose of having this team was so that we could separate the hospital facing work, for example, the discharge to assess referrals that come into all age continuing care, but also our hospital fast track referrals. So bringing them into one team so we don't have several teams overwhelmed with lots of different pockets of work. They can all be very selective in what they're doing. So with the discharge to assess, I call it D2A team, this team works at system level and has place-based links. So the benefits of this is close working with our discharge teams and our local authority colleagues, improve patient experience. So in that the right patients enter the right pathways. So for example, our fast track patients don't end up on a D2A pathway that takes longer to go through. They go straight into a fast track placement or home with care or whatever is required to support their end of life needs. To ensure that any issues are resolved in a timely manner. There's equity across the patch, there's no postcode lottery, and we have one team as a point of contact. Okay. So this particular team will triage and authorise referrals, like I said, ensure the right people are on the right pathways. They will also support with the sourcing alongside the hospital brokerage processes, the placements and packages of care. They will do the communication and links with our patients, family providers. They'll track and monitor any clients within that go through the D2A team, complete assessments, and it also ensure that all the clients are safely transferred to an appropriate placement afterwards or home. Next click, please, Steph. They'll work alongside the D2A discharged teams within the acutes and ensure that processes are the same processes are embedded throughout the whole ICB to eliminate any postcode lotteries and variation. And yeah, it's just a repetition of what I've said already. Next clip, please, Steph. You're doing a great job, Steph. Thank you. So what is all age continuing care and IPA? So all age continuing care, so the new acronym AACC. So this is a collective term for the NHS services that provide funding for the care of needs of individuals of all ages. So this was, you may be familiar with CHC, so that's for adults, and CYPCC, so children's community continuing care. So this is a collective term for everything. So this refers to the funding for any people requiring assessed as having a primary healthcare need and receiving funding, NHS funding for that. IPA refers to packages of care or rehabilitation that's either fully or joint funded by the NHS or the local authority. So these are non-CHC clients. So might include Section 117 and other individuals with complex health and social care needs. And just to emphasise, within the new service model, all age continuing care, all teams within the all age continuing care portfolio will have the resource to complete reviews and case manage all of the clients. Next slide, please, Steph. So why does it exist? So all age continuing care, this is a statutory responsibility and is also governed by NHS England. So we're reportable to NHS England. We follow a framework for children's continuing care. We follow the national framework for continuing healthcare and funded nursing care. And we have to report to NHS England on a monthly basis. We have a quality premium to meet and a number of KPIs that our service is measured on. IPA, individual patient activity, this exists to ensure that patients who don't have a primary health need but do require services to be funded or the provision of services from the NHS, it allows those clients to have the funding and access to services, and also allows for joint working within sort of the local authority and health partnership. Also supports end of life and vulnerable individuals to receive safe and appropriate care to meet their care needs. Next slide, please, Steph. So the purpose of this presentation, and I know we might not have time, Tracy, like you said, to open up for questions. We are going to be, myself and colleagues will be joining the next assembly face to face, so we can explore some of these things further. But it's really to leave you with some food for thought, really, and explore what we could develop together. And some of those thoughts are some co-production groups, and also understand more about what you do as a sector, and how and what areas we can collaborate in and develop further, and what can we bring to the table together, really, and work in partnership together for. So, you know, it could also be directing individuals within our services to services offered by yourselves. Now, a couple of within all age continuing care, we are growing our personal health budget service. So we haven't been performing according to our statutory responsibilities. Our PHB offer was very small. We are growing this considerably, and we've had approval to roll out a service that is performing very well across the Blackpool place, across the whole of the Lancashire County Council footprint as well. So that will add a considerable amount of quality and improve patient experience to the service, and I'm sure that there'd be lots your services could support with, and we could work together on there. Next slide, please, Steph. And that's everything from me, everybody. So really interested in understanding more about what you have to offer, and it'd be really interested to understand more about what we can do, as well as understand what you've got to offer, what within that what we can do together collaboratively. So really excited to be working with you, and I can't wait to meet you in the next face-to-face meeting.
Thanks, Raki. That was really interesting, and I think it stimulated quite a lot of thought and debate around not just how do we work together, but how are we at the moment, kind of what does the picture look like? Because I know working across Blackpool, there are advocacy services that work closely with the continuing healthcare service, as well as voluntary sector organisations that are part of that integrated offer around personal health budgets. But I suppose it's exploring the art of the possible around some of that as well. So yeah, really exciting proposition. If there are, we have got a few minutes, so if anybody has any questions for Raki just in the last few minutes, please put your hand up. Really good news that you're going to come along to the next assembly in March and carry on with these conversations, because I know there's a lot of partners here who'd be really interested in doing some of that work around the co-production side of things, and looking at that more integrated model. I can't see any hands. Are there any questions in the chat that I've not really seen? I think picking up on what Mike asked around, specifically around Age UK, it's probably more about understanding what already exists, who already is involved in some of this work as part of our sector. And I think really just looking at, like you said, how do we go forward in kind of developing something that has that kind of integrated feel to it. Joe?
Thanks, Tracy. Not so much a question, just more about how I envisage it going at Assembly 7. Raki and I sort of jokingly said that they would have a stall at the event, but actually it's probably going to be more along the workshop idea. So I suppose what I'd encourage is any organisations that are, you know, have interest in advice, advocacy, care navigation, that kind of thing, definitely seek out the all age continuing care team that will be at Assembly 7. We'll people who came to the last one will know the layout of the room, so there'll be like a set of tables that will be available for that. And I think it's really the conversations that Raki and the team and I have had are really hopeful, really positive about what can we learn and move forward with together. It's not always about money, but it is definitely part of it. And I think there needs to be we can have a different conversation than perhaps we've had in the past. So I really encourage people to engage with that at Assembly 7. Thanks, Tracy.
Thanks, Joe. And I would also encourage people, if you're not sure whether you can, there's something that we can do together, just to come and have a chat, and we can talk about. I can explain a little bit more about all age continuing care, because I know I've just done a little bit of a whistle stop tour today, but there's loads, absolutely loads that many of you, I'm sure, could get involved in. Have I frozen, Joe?
You have, yeah.
Yeah, frozen.
You can hear your voice still, so that's good. But
okay.
Yeah, your picture's frozen, Raki. Yeah.
Okay. Oh, sorry, Tracy. Yes, I'm sure there's loads that we can be doing together, and I'm quite excited about, you know, what the future could hold. And I'd really like to be supporting you with your journey with the ICB too, because you know, I feel like, you know, that's challenging at the best of times. It sounds like you've got some great links into the to the right people, and it sounds like you're a really, really passionate group of people that, you know, really, really looking to do the very, very best for our clients and patients within the ICB. So really, really excited to be working with you in partnership. And I'm really excited as well that we've got our quality team. We've got 2 members of our quality team in this room today as well. Our quality team is a new part of the service, all age continuing care service. We've got Joe. Hi, Joe. Thanks for joining. I think we've got Rebecca as well, haven't we? And Steph. Oh, hi, Steph and Rebecca. Brilliant. So Joe, Steph and Rebecca are 3 new members of our team, part of the Quality Hub within All Age Continuing Care. And the Quality Hub is a really, really crucial part of what we're going to be doing and developing within the service. And we are going to be looking at, obviously, significantly improving the quality of what we offer within All Age Continuing Care. But also the Quality Hub, our colleagues here are going to be supporting with bringing on and progressing some of our relationships. I think we could do some great work with clients with lived experience of continuing care, and what our patients with lived experience can bring to support us with our journey. Our PHB service delivery is going to sit within the quality team as well. So, you know, I think colleagues here will be able to support the sector and you know, enhance our relationships and what we can do together. I don't know whether any of you wanted to, whether anybody else had anything to say, but I don't want to put anyone on the spot because Steph, Rebecca and Joe are all brand new into the service.
Well, it's really good that you've come along today. Thank you for coming, all of you. And as Raki said, you know, I think continuing that conversation will be something that we can do when we come together at the Assembly in March. Rebecca, did I see a hand go up?
Yeah, just wanted to say hi, really, and thank you for inviting me along. I know prior to me officially starting, I did attend one of the AACC meetings that Joe Hannah attended, which was really interesting. And I just want to say that I'm really looking forward to working with you more closely, really. Particularly around the patient experience side of things, because that's what my role is. I'm the patient experience and complaints lead. So I think certainly trying to kind of get more information out there as to what is available to patients, and to hopefully try and improve how people can, like patients and families, can navigate the service, and things like that. So yeah, because it's quite a complex service to try and navigate, even when you're within the system. So yeah, I'm looking forward to that. So thank you.
Thanks, Rebecca, and that's really good to know that you're the link for patient experience. I think there's so much work happening across our sector around lived experience, around understanding how we improve things by listening to people who have that experience. It's so important, and such a big agenda for us as well. So yeah, brilliant news that you're there and you're doing that work. So thank you. Thanks to all four of you, particularly to Raki for coming along and presenting. We look forward to seeing you at Assembly 7. Which I'm going to kind of hand over to Joe now, just to say a little bit about Assembly 7 and the arrangements and what the plans are.
Thanks very much. Yep, Stephanie should be chucking the slides back up any second. Assembly 7. So the first in-person assembly was a real success. We've learned some lessons from it, so there will be some changes. We've got a planning day for it on the 1st of February. So I'd definitely welcome any thoughts that people have on what they'd like to see in the event, and Stephanie will very likely be sending out some kind of a questionnaire or survey, or maybe just an email to gain your thoughts, especially for those of you who are there in October. But so it's going to be at the same venue, Wesley Conference Centre. Again, provided free of charge by University of Central Lancashire, the social prescribing unit there. Thursday, the 21st of March, 10 a.m. till 2. There will be lunch, as there were last time, and refreshments and what have you. It's all up on Eventbrite. The link is in your agenda packs. It's also linked to from the voluntary sector pages on the ICS website. This one is going to take a different form. This is going to be much more about voluntary sector out, talking about what we do. So definitely kind of a prelude to the state of the sector stuff as well, from my perspective. But then also having people there who it would be useful for them to listen to. That's not the entire point of it. So it's not like an expo, where we hope that commissioners will come. It's a different idea. So as I said, there'll be more details after the 1st of February when we've had the planning meeting, but it's very much more a forward-looking, positive voluntary sector assembly. Tracy, have you got anything else to say about that?
I suppose really just to emphasise that, I think what we've done in the previous assemblies is we've brought in colleagues from across the ICB and across local authorities. And what we really wanted to do with this coming together is really promote and recognise the contribution that we make as a sector. And I think it's really important that we showcase organisations and talk about the great contribution that we're making to the lives of people across Lancashire and South Cumbria. Like Joe said, we're going to do some planning around this. So if you do want to get involved in any way, then do let Joe and Stephanie know. And also, just on a really positive thing, we were thinking that this potentially could have been the final assembly that we're involved in planning. But we're getting indications that actually there is going to be some resource for us to carry on doing this work. So hopefully you'll find that as a positive thing, and that there will be an Assembly 8 potentially at some point in the future, and we're going to carry on with the work we're doing around the Alliance as well. So we'll send you more details out once that's a bit more concrete, but I just wanted to let you know that we're not going anywhere at the moment. We're still here and we're still working away. So yeah, thank you. If nobody's got any other comments, anybody want to add anything? I'm going to give you 5 minutes back, which is always nice, isn't it, at this time of day? So take a break, stretch. And thank you all very much for coming along. I'm assuming there's no other business. Nope. great to see you all. Thank you so much for coming and sticking with the whole 2 hours today. Thanks,
Yeah,
everyone.
thanks everyone.
Thanks all. Bye.